Top trends and how they affect your health. All new on The Doctors. And one touch of this food can lead to this. Then, want to go down a pant size?
It feels like a heating pad or warm blanket during treatment.
Doctor, give me the news.
There's something fishy swimming in New York City, and it could make your hands look like this. Health officials have discovered an unsightly skin-eating bacterium in New York's Chinatown, infecting those who handle raw fish or live seafood, producing redness, lumps, and swelling. The outbreak has affected at least 30 people so far.
You know, we've talked about the concerns of eating raw fish before, but never something like this. We're joined by board-certified dermatologist Dr. Melanie Palm to talk about this skin infection because we've not talked about this before. In fact, we were discussing this. This isn't something you're seeing each and every day. So what's going on here?
It's a class called atypical mycobacterial infections. Okay. So we sometimes see it in cosmetics if contaminated water has been used. This particular strain is usually found with fresh water or saltwater components with some sort of aquatic life. So I think that's why we're seeing it with some of the raw fish.
Can't you get this in aquariums too?
You can.
I think I remember from medical school.
Yeah, if you think back to that, say we classically call it fish tank granuloma. Because our body's way of defending it off is basically building a little collagen wall around it, which we call a granuloma when you take a look at it under the microscope.
And when you say mycobacterium, that's a cousin of tuberculosis and
which our body
leprosy.
responds in a similar way. And so, you know, I don't want people to be alarmed that they can't eat raw fish or they shouldn't handle things. Basically, how this happens is you have to have two things. You have to have the bacteria on aquatic life, and then you have to have some sort of portal of entry, and typically that's the hands. We as dermatologists, that's usually the classical story. Some pink welts, sometimes a pus-like bump that's on this area.
And when you say portal of entry, it'd be your hands, but you'd have to have some sort of a cut where that bacteria can get into the cut. Pull that picture up again, too, if we could, because you were talking about the granuloma element. This looks a little different than a typical skin infection like a cellulitis. Those big welt, that's that granuloma formation that you're seeing, because this is not something that you're going to just diagnose necessarily without maybe sending off to a lab and getting a formal diagnosis.
Diagnosis is important. Usually patients will come in and they've had this several weeks, sometimes months. And so tissue is the issue. You always want to get a sample of skin. A simple swab isn't going to be able to yield the results from this. And it's slow growing, and it likes to grow at colder temperatures. That's why it kind of likes digits. It likes hands and feet. So it takes several weeks for us to get the results back. I've actually had a case of this. If you've got a high suspicion, we start patients on antibiotics, but typically almost the gold standard these days is doing dual therapy, so actually starting 2 antibiotics because you are susceptible to resistance.
And it's interesting because these mycobacteria, they're smart bacteria in a way, and they get themselves walled off into these granulomas, and so the antibiotic penetration isn't that great. So just like for tuberculosis, which you have to treat for a really, really long time, and you have to be so vigilant, same thing here. Is that not true?
Exactly. It's that same sort of thing. You know, since it's on this same sort of spectrum, you can think of it in that same sort of way because our body has the same response. And even once you're clear, really the recommendation is to treat patients for several months beyond that.
And if you ingested it raw, I mean, your GI tract would not get an infection from this, right?
No.
So this is not, you're going to the store to pick up fillets, not really an issue.
No.
This is handling the actual fish. And if you're going to do that, you really should be wearing gloves, right?
Yeah.
Given that this outbreak's occurring.
Sushi is safe in New York City. I don't want people, you know, going out into a panic.
It's like, I watched the doctor's
calls on this one.
That's great because New York City has some of the best sushi, so that's good to know.
And fish is incredibly healthy for you to eat, so thank you for helping us shed some light on that.
Thank you.
Of course, we'll keep you posted at home. In the meantime, stick around for what's coming up next.
Coming up next, are you ready to trim your waistline without having to do a single sit-up?
If somebody isn't quite ready for surgery, has a little bit of a bulge.
Find out what treatment can virtually melt away your fat. That's next. Love handles, spare tire, muffin top. Whatever you call it, we all want to say bye-bye to stubborn, unwanted fat on our bodies. We've tried freezing, melting, and zapping it away. But before you say just suck it up or attempt to suck it in, is there a way to vanquish those extra pounds for good? And could this be the answer?
A painless way to get rid of your pooch? Sound too good to be true? Well, let's go to the procedure room to see a new treatment in action with Dr. Worden. Take it away, my friend.
That's right. There is a new treatment on the block for ridding those so-called figure faults that so many of us have. And Dr. Palm, Melanie, is back with us as our guest expert, and she's brought a delightful patient and guest, Paige. Now, Paige, you were telling me you're a spinner. Yep. You do your yoga a couple times a week, but in spite of that, you have a couple of areas that are bothering you. Tell us about that.
Yes. Well, it's just you're working out, you're eating well, and it's not going away.
So specifically, what areas, if you could?
The stomach.
The tummy. A little bit of a pooch. All right, yes. Dr. Palm, what do you have for us?
So we have something called Vanquish, which is really new in its field of radio frequency, which basically, you know, is a special form of electricity.
Right. We've been using radio frequency for years now, but the technology that you brought here today is quite different.
So this is non-contact. It actually hovers over her body, and it heats up the fat cells to a point about 120 degrees Fahrenheit, where a certain amount of them undergo apoptosis, or controlled cell death.
Apoptosis. I like that. Let's start, okay?
Yeah, so
you're actually, we have Paige here. I see you brought your Vanquish machine.
We did.
Let's do her treatment. Typically, how many?
We typically do weekly treatments, and 4 to 6 is recommended. If you look at the studies, it was based off of 4 weekly treatments. They're 30 minutes each, and with that, and if you'll bring your arms up for me, about 2¼ inches were lost off of the waistline.
In 4 weeks.
After 4 weeks, 2¼ inches?
Yes, that's right, Dr. Rachel, and you're melting the fat, but the question is actually, she getting the treatment now?
She is. It's quiet, isn't it?
Yes.
It seems like nothing is happening. It's
this really is, because other radio frequency, you get little, you feel it.
Yes, and that's what's different. This is multipolar, and because of its high tuning ability for fat specifically, it does not affect the overlying skin. It doesn't affect the underlying organs. It really just heats up the fat.
We should mention that you've melted the fat cells. The body has the ability to eliminate those cells. But, you know, downsides, I mean, it's not for somebody that has large areas of fat. We both do liposuction. Obviously, classical liposuction would be better in a case like that where you have a lot of fat. But in Paige's case, it's just that little pooch. And we do have some photos that you were nice enough to bring from the study that show what kind of results Paige can look forward to.
And these are actually my own patients.
Okay.
So, inches lost between about 1½ inches and 4 inches. This patient, I believe, lost 2 inches off of her waistline. So this is really for someone hoping to lose like a pant size. It's not, you know, a substitute for good diet and exercise. It's not a substitute for surgery. But if somebody isn't quite ready for surgery, has a little bit of a bulge, this sort of fits that happy medium, I think, for patients looking to really help that area.
And no bruising?
No, it feels like a heating pad or a warm blanket during treatment. It really doesn't hurt.
It's very comfortable.
Just think, you're sitting there, losing your fat.
Read a book.
I'm jealous.
Like on your phone.
So it's great. Really, afterwards, the skin can be a little bit pink, and you've warmed up the core a little bit, so you can be a little bit warm for a few minutes in that area, up to an hour or so.
And that brings up another topic. Who would not be a candidate? Somebody with a lot of loose skin. You know, you are, due to the heat, you will get some skin tightening as well. That's part of the good thing about this technology.
And that's not on label. It's FDA approved for deep tissue heating, but we use it for body contouring and fat reduction. But yes, we have noticed that people get a little bit of skin tightening along the way.
Well, Dr. Palm, thank you so much for sharing this technology with us, Paige. Best of luck to you.